KWOS Open Air, our guest with us for the rest of the hour. How are your feet feeling this morning? Well, we've got the experts in with us, Dr. Jody McAleer and Dr. Bill Duke. Gentlemen, welcome in, and Doctor, welcome back.
Morning, thanks for having us again.
Yeah, good morning, thank you. Enjoy being here.
Talk to us a little bit about your practices. Practice?
We work at, we are both podiatrists. We work over at Jefferson City Medical Group. Dr. Duke and I have been there for a combined almost 22 years now.
Long time.
Yeah, if you had all our time up, we're doing great. We have a busy practice, lots of interesting new things going on.
Yeah, and I think that's one thing you guys wanted to talk to us about, a new procedure.
Absolutely. We have a new bunion procedure that we're doing. You may have heard about it through some of our other seminars and whatnot. It's called the Lapiplasty Procedure. It's actually pretty revolutionary as far as reproducibility and the ability to let people walk almost immediately after surgery.
Talk to us about that, and maybe give us a background, because bunions, you know, people don't realize, and maybe you've never been down that road or had a family member or something. They can be literally debilitating, crippling for people, can't they?
Very painful, difficult to wear shoes. It can alter your quality of life pretty significantly. And the old procedure that used to be done for this could potentially keep you up off your foot for about 6 weeks up on crutches, or really have to modify what you're doing with your daily routine. But with the new procedure, we get you walking the day of, get you moving back in shoes at 6 weeks. So really cut down the amount of debilitation, if you will, after the procedure.
What is a bunion?
You know, I tell people a bunion is kind of like a progressive dislocation of your big toe joint. Your big toe just starts to drift further and further towards your other little toes, and over time you get this big bump on the side of your foot that, like Dr. McAleer said, gets hard to wear shoes with, do certain activities with, exercise with, and then it starts to affect your everyday activities and your quality of life. And eventually people come in and, you know, they look at you and go, I can't wear shoes anymore, I can't exercise anymore, I can't hang out with my kids and play in the yard anymore, you got to help me.
Mm-hmm. So Lapiplasty, what happens in Lapiplasty? What are you going to do when you come in those kinds of, what kinds of machinery are you going to see in those kinds of things?
So the improvement, the old procedure was called the Lapidus procedure, and basically what you're doing is you're removing some of the joint cartilage in the middle portion of the foot to bring the metatarsal bone and the big toe joint back into alignment. The problem with that is the old way of doing it would only correct in 2 of the 3 planes, if you think of like an XYZ axis. So it did not account for any type of rotatory component or rotational component of the metatarsal. So what we're doing is, with our new instrumentation, we've improved on an age-old procedure, which allows us to derotate the metatarsal, decrease the angle, straighten up the big toe, lock things into place, and make it so that the joints could be functional. The procedure is reproducible, and it also allows for almost a 0 recurrence. And we use a special cutting jig, which allows us to remove the most small amount of cartilage or bone possible in order to avoid shortening of the metatarsal and to keep the anatomy as normal as possible.
So this is done under local anesthesia?
General anesthesia.
Okay.
Yeah, go to sleep for the procedure. Yeah.
But it is done in the outpatient surgery center for the vast majority of cases. So it's a great friendly environment at JCMG. There are some patients that need to go to the hospital for it, but the vast majority we can do at the surgery center. And the procedure takes under an hour. I mean, it's pretty quick. You're not there. There's no overnight stay required with it. And like Dr. McAleer said, you're walking the next day.
I know, Doctor, when we've talked to you about it before, the previous procedure wasn't always a 100% guaranteed fix, was it?
No, unfortunately, there's a very high reoccurrence rate, even though all the surgeons are trying to do their very best job for you. The older methods take a straight metatarsal bone and they cut it, and they move it over partially in order to try to decrease the size of the bump on the side of your foot. But in doing so, they take a straight bone and they curve it almost like a banana would, and then over time, because that joint in the middle part of your foot that we addressed through the Lapiplasty, that's still unlocked, the deformity can come back over time and that bone can continue to shift because of the faulty biomechanics of the foot.
Dr. Bill Duke, Dr. Jody McAleer in with us this morning, talking to us about some procedures involved with their practice. Well, Podiatry at the Jefferson City Medical Group. Also some ankle joint replacements, some, pardon the pun, cutting edge things happening there. We can talk about that a little bit when we come back on KWOS Open Air. All right.
When you're talking to surgeons, we always want to get the cutting edge.